Good evening, folks. This is your D for you. We will get started. The title is What Does Corridor Care in the NHS is a Crisis in Plain Sight mean? This phrase startlingly captures a deeply troubling reality in the UK National Health Service. Patients are being treated in hospital corridors on stretchers, trolleys, in chairs, or even in repurposed storage areas because there simply aren't enough beds or critical spaces or clinical spaces. The term crisis in plain sight underscores that this isn't a hidden or emerging issue. It's a visible, normalized failure of the system that patients, staff, and visitors witness daily. It reflects a breakdown in hospital flow and capacity so severe that makeshift care in inappropriate spaces has become routine. What evidence supports this characterization? The surrounding coverage draws from a range of authoritative sources and first-hand accounts. Age UK, for example, complied testimonies from older patients who described being left for hours or even days in corridors, often without privacy, basic comfort, or timely medical attention. Some recounted witnessing others die while waiting. The Royal College of Nursing, the RCN, surveyed thousands of frontline staff and found that corridor care is not an occasional fallback. It's a widespread systematic practice. Nurses reported treating patients in unsuitable areas like cupboards, waiting rooms, and even car parks. These conditions have led to missed observations, delayed treatments, and in some cases, preventable deaths. What kind of situations are described? The reports are harrowing. Patients have been left in chairs for 12 hours or more, hooked to IV drips without access to toilets. Some have soiled themselves because they couldn't get help in time. Others have been lost. in systems placed in obscure corners of hospitals where staff didn't know they were there. In one case, a patient died after waiting for hours in a corridor without being properly monitored. These are not isolated incidents. They are emblematic of a system under extreme strain. What's driving this crisis? The root causes are complex but interconnected. The article points to a cascade of systematic pressures: overcrowded emergency departments, A&E surging, demand, especially during winter months, overwhelms capacity, delayed discharges, patients who are medically fit to leave remain in hospital beds due to a lack of community or social care support. Staffing shortages, chronic underinvestment, and burnout have left hospitals understaffed, making it harder to manage patient flow. Insufficient bed capacity. The UK has one of the lowest numbers of hospital beds per capita in Europe and may have been lost over the past decade due to austerity measures. These factors combine to create a bottleneck. Patients can't move through the system efficiently, so if they end up stuck in corridors, what are the consequences? The human cost is profound. Patients suffer indigencies and health risks, including pressure sores, infections, and psychological trauma. Families are distressed by the lack of privacy and the visible suffering of their loved one. Healthcare workers experience moral injury, feeling unable to provide safe, compassionate care in such conditions. There's also a broader public health impact. People who've endured corridor care may delay seeking help in the future, potentially worsening outcomes and increasing long-term health care costs. What's being called for? The surrounding coverage is inequitable, This is not just a logistical issue, it's a moral and political one. Advocacy groups, professional bodies, and journalists are demanding immediate recognition of corridor care as a systematic crisis, not a temporary inconvenience. Investment in hospital infrastructure, including more beds, better designed spaces, workforce expansion, and retention strategies to address staffing gaps, improve discharge planning and social care funding to free up hospital beds, clear accountability mechanism to ensure no patient is left unsafe in an unsafe or undignified conditions. In essence, the phrase crisis in plain sight is a call for action to stop normalized and abnormal and to confront the structural failures that have made corridor care a grim fixture of modern NHS hospitals. Guys, the reason that I did this show was because this happens everywhere, not just England, but here in the US also. People getting treated in hallways, in unsuspected places. People being left in hallways on stretchers for maybe having x-rays done or different kinds of tests. That happens in each hospital everywhere, not just the UK. That is why I did the show tonight, for you all to get an FYI, so that if you see something like that happening in a place where you're going to get care, if you see something, say something to somebody, because it's not first of all, it's not anybody's business what happens to people's care. That's a private issue. Okay, so with that being said, I will see everybody tomorrow for shows, tomorrow evening or Saturday for shows. For now, Gator Wellness, take care, folks.